This machine is the Diopsys Nova for ERGs, which are electroretinographies. So basically we're measuring the electrical impulses of the photoreceptor cells in the fovea. So we do it for any retinal problems. Let's say they have AMD, ERM. We can look at the concentric, and if they have glaucoma or diabetes, we can do a contrast. So when to start, we're going to have these different electrodes. So this electrode will go onto their forehead, and these lid leads will go underneath their eyelids. So we'll start with the forehead electrode. So they have this amplifier module. I'm going to just have the patient hold on to it for now. So there's 3 cords. There's a right eye, left eye, which attach to the lid leads. And we have this green wire, which connects to our electrode for the forehead. So we're going to just connect these first. They'll snap in place. We'll take this off. And we're going to use some conductive paste. And just apply a small dot onto that green part. It's really all you need, is just that much. Now before we apply it, we want to use this skin prep gel, just to wipe away any moisture or dry skin or any makeup. So we can use a gauze pad. We'll apply just a very small amount. And we're just going to cleanse the area. You want to use the same gauze pad. Just dry everything off right in the center of the forehead. I'll use a tissue just to make sure everything is wiped away. So now we have a nice clean surface for this electrode to bind to. Okay, so this will go right on the forehead, right in the middle. Just press the center down, and then you want all these corners to be sticking onto the forehead there. Okay. Hold on to this for now. Then we're going to use a lid scrub just to clean off the bottom of her eyelids. You want to just close your eyes for a second. You can just wipe about 3 times. 1, 2, 3. And 1, 2, 3. So any makeup again or dry skin, we'll just wipe away. And then again a tissue just to dry everything off. Okay. And then we'll apply the lid leads. These just come off. We'll take this little tape off. So again, close your eyes. And you want to apply it right underneath your lid, but on the actual lid itself. Make sure everything sticks on. And then we'll do the same thing for the other eye. Just keep your eyes closed. Okay, just like that. Now we're going to connect these to our connectors. So OD is right eye. So this should click right in. And don't push it too hard. There's one connector pin in there, and if you push it too hard, you can bend that connector pin. And I'll move over to her left eye. We'll do the same thing. Just gonna bring this over a little bit. So snaps in place, so everything's all connected. She looks good to go. Now we're also going to do one eye at a time. So I'm going to have her just cover her left eye with this patch. So the hardest and longest part is just getting everything set up first. But once they're set up properly, we can enter all their information in. So we can either add a new patient here or find a patient. We're going to find a patient first. And then once you find them, we're going to click on their name. Make sure we have everything in here. So we have their first name, last name, date of birth, male or female. We're going to put in their prescription either from their last refraction or their auto-refraction. Now, if they wear distance glasses, they're going to wear their distance glasses, not their reading glasses. If they're over 40, you're going to set the add, which you'll see in a second, so plus 150. And if they're under 40, you're going to just leave the add as Plano. So you won't add any more additional prescription onto their distance prescription. So you're going to just put her prescription in here, what she sees. We're going to put in plus a quarter, minus a quarter at 90. And her best vision is 20/20. Left eye, same thing, plus a quarter, minus a quarter at 100, 20/20. Then we'll click OK. Also, if they wear bifocals or progressives, you want to use trial frame glasses. So they should not be using any bifocal or progressive glasses, only single vision distance glasses. So next we're going to click on the ERG. We'll make a new test. So this is where you'll add the addition. So if they're over 40, you'll put a plus 150. If they're under 40, we'll leave it at 0. And then we're also going to choose whether it's concentric or contrast. So again, concentric, we're going to use that for AMD, Plaquenil, or if they have ERM, epiretinal membrane. And the contrast we use if they have diabetes or diabetic retinopathy, or if they have glaucoma or are glaucoma suspects. So we'll do a contrast. Our center should be green, which lets us know that we have everything set up properly. We'll be testing the right eye and left eye. And we're going to hit run test. So before we start, we want to make sure that all the lights are off on the in the room, and then also that the computer screen is also turned off. So you want a nice dark setting. So again, just a quick check to make sure that the patient is situated properly. Basically what's going to happen is you're going to be seeing, or the patient will be seeing, some flashing lights, which you'll see in a couple minutes. We always ask the patients if they have any history of epilepsy or seizures, because if they do, we're not going to do this test for them. And then once the left eye is patched, we'll click OK, and they're going to be seeing those flashing lights. They're going to be looking at a little crosshair in the center of that screen, and they'll be hearing some music. So click OK. So this is what the patient is seeing. Good. So it asked if the patient was focused on the screen. They were. And you should be seeing 3 peaks here. Most of the time they'll be even, but this looks pretty good. So that's their amplitude. And basically, as they're looking at those blinking lights, there's impulses being sent from the retina to the optic nerve to the brain. So in this patient, everything looks pretty normal. So they were focused on the screen. We're going to click on yes. If this looks abnormal, if you're getting all weird squiggles on that graph, you can click on no and repeat it. But this is the high contrast part, so we're going to click on yes, and then we'll repeat it for the same eye at a low contrast setting now. So again, just keep looking at that screen. Okay. So if you notice, they usually should be a little bit lower in amplitude, but they should be about the same pattern. You can see there's one here, two here, and the third one which measures up with that last peak. So this one I would probably repeat, but just for our purposes here, we're going to click on that they were focused on the screen. But again, you'll go get those 3 peaks for each high contrast and low contrast. Also on the top here, if you notice, there's artifacts. So that's when they're blinking or moving. So those should be close to 0. So if we get 1, that's still okay. But if you get about 10 or more than 10, you want to repeat it, and it'll give you an error message saying that there's artifacts detected. So we'll click on yes, and then it'll ask you to do the left eye.